Hi everyone, welcome to the eye dissection video. We'll be going through the details of the sheep eye dissection only as much as is relevant for the NS 3420 course Anatomy and Physiology labs. I'm Dr. Michael.
I'm Joydeep, and I'll be going over the external anatomy of the eye.
I'm Catherine, and I'll be going over the interior structures of the eye.
I hope you enjoy our video.
This is the eyelid, which protects the eye and keeps dust and debris out, so you can see that right here. This right here is the cornea, so this semi-transparent structure, which is the anterior covering of the eye, and it helps to transmit light and focus light rays at the back of the eye. This hard surface right here, all around the eye, is the sclera, which is the posterior covering of the eye, and it functions to protect and shape the eyeball, and it also anchors the extrinsic muscles that you can see better on this sample, which you'll see is a bit more pink in color compared to all the white fat around it. And these extrinsic muscles are composed of skeletal muscle and basically control the movement of the eyeball. And lastly, this white fat you see around the eye is the periorbital fat, which cushions the eyeball in the eye socket of the skull when it's laying like this. We are now going to use the scissors to cut away all this muscle, fat, and connective tissue surrounding the eye to clearly observe the optic nerve, which is on the posterior surface of the eye. And the optic nerve transmits electrical impulses originating from the retina, which we'll see on the interior surface of the eye, all the way to the brain.
So I'm going to show you how to identify the optic nerve. If you look at the posterior aspect, you will feel the optic nerve. As you remove the periorbital fat around it, you can see it a lot clearer. I'm going to use my pair of scissors and just cut away this periorbital fat. I want to be careful to not puncture the sclera, but I'm just cutting around the optic nerve here. Now that I've cleared away the periorbital fat and the extrinsic muscles, you can see the optic nerve a lot more clearly.
Now that we've cut away all the muscle, fat, and connective tissue surrounding the eye, we can clearly observe the optic nerve on the posterior surface of the eye. And the optic nerve right here transmits electrical impulses originating from the retina all the way to the brain.
So now, using my forceps, I'm going to anchor the specimen so that the cornea is on the left and the optic nerve is on the right. Then with the scalpel, I'm going to gently make an incision on the sclera, which is between the cornea and the optic nerve. And if this is not done gently, then fluid will squirt out. So the fluid instead should be oozing out. And remember, we are going to want to cut away from our bodies. So next, I'm going to insert my scissors into the slit made by the scalpel and cut the sclera with a shallow snipping motion. Notice that I am cutting the sclera all the way around the eye, making a frontal cut. Now we can observe the internal structures of the eye and better appreciate its internal compartments. The transparent fluid is the vitreous humor, which fills the central cavity. It might appear cloudy in your specimen. However, in this one, it is relatively clear. So notice our vitreous humor is now in the anterior aspect of the eye. Sometimes it will appear in the posterior aspect, but regardless, the vitreous humor will allow us to see the retina, which is in the deepest layer of the eyeball. So the retina lies in the posterior cavity and extends forward to the ciliary body. So I'm going to use my probe to lift and pull back the retina from the choroid. Notice the retina is only firmly attached to the choroid at this junction here, called the blind spot or the optic disc, and this is due to the absence of photoreceptor cells, which creates a blind spot. This is where all the nerves join to leave the eye as the optic nerve. The retina itself contains photoreceptor cells which are sensitive to light and create nerve impulses which travel via the optic nerve to the brain. Using my forceps, I'm going to continue to peel away the retina from the underlying choroid layer. So the choroid layer is dark and relatively thin. Using my forceps or my probe, I gently separate the choroid from the sclera. The choroid is the middle pigmented and highly vascular layer which supplies blood to the retina. The dark pigment also helps to absorb light, whereas the iridescent part, which you can see here, is for the additional light reflection in the dark for night vision. So now you can see here we have a lot of vitreous humor, so I'm going to use my forceps or my probe in a gentle scraping motion to remove it. Again, this may appear cloudy in some specimens, but you can see here it's very, very clear. So this is going to reveal the posterior view of the lens, the ciliary body, and the suspensory ligaments. So don't be surprised if your lens pops out alongside your vitreous humor. You can see here that's exactly what happened. Our lens came out with the vitreous humor, but it really demonstrates the suspensory ligaments here and how that connects to our choroid and really anchors our lens into place. So now I'm going to pop the lens from its place and remove it from its attachments using our forceps. Holding the lens with my forceps, I'm going to cut the lens in half using my scalpel. Notice that the shape and consistency of the lens is thick and dome-shaped. It is a biconvex, transparent, flexible structure enclosed in an elastic capsule, and it changes shape to focus light on the retina. This may appear difficult to cut through, it may be slightly waxy. So here we have our two halves of our lens. Now again observing the anterior portion of the eye. So now that the lens is removed, an opening called the pupil can be seen. The pupil allows light to enter the eye, and it's located at the center of the iris. Two muscle layers of the iris control the size of the pupil, so that would be pupil dilation and constriction. Here you can also notice the ciliary body, which is a thick ring of tissues that encircles the lens. It's composed of smooth muscle bundles that shape the lens. It also has ciliary processes, which contain capillaries that secrete fluid into the anterior segment of the eyeball. So to gain an appreciation of the anterior segment of the eyeball, I'll remove the cornea. So if we flip over to this side, so we'll be removing the cornea. To remove the cornea from the eye, I'm going to use the scalpel blade to puncture a small slit at the junction between the cornea and the sclera. You want to be gentle here because you will feel a give when you have punctured through. You can use a small motion here. And now you can see that we have gone through. So next I'm going to insert my scissors into the slit and just cut all the way around the cornea. Now again, you want to be careful here as to not cut any other structures. Be as careful as you can using these shallow motions so that you are not damaging the iris. Once you have removed the cornea, you should have an anterior view of the iris. A second cavity, the anterior segment, is present between the iris and the cornea. It is filled with a semi-liquid fluid called the aqueous humor. And like the vitreous humor, the aqueous humor maintains the shape of the eye. However, in this sample, we are not able to see it. Thank you for watching our video on the dissection of the eye. We hope you enjoyed.